You need to look at the neck of the patient, you need to palpate the carotids, and also if there were venous pulsations, I mean if there are pulsations, then you need to identify whether these are arterial pulsations or venous pulsations. You need to place your thumb to occlude, you apply gentle pressure at the base of the neck. एक फोकल पॉइंट पे नहीं आप अप्लाई करते, बल्कि पूरे का पूरे थंब के साथ आप ऐसे प्रेस करेंगे तो इट विल कंप्रेस द बेस ऑफ द नेक. नाउ इफ यू प्रेस द बेस ऑफ द नेक, it's you apply gentle pressure, and if there are no more pulsations, these were venous pulsations, and if pulsations persist, these are arterial pulsations. Another question that examiners commonly ask is, what are the differences between arterial and venous pulsations? And you have a list and a table of those differences. Do memorize those differences in the arterial and venous pulsations because it is frequently asked in the exams. They also ask in which vein you measure the venous pulsations. It is internal jugular, right internal jugular vein. Which one is preferred, external or internal jugular vein? It's internal jugular vein, and the examiner would ask, why do we prefer internal jugular vein? One, because it's in line with the superior vena cava and right atrium. Two, it is straight as compared to the external jugular vein, which is somehow tortuous. It has no valves, while external jugular vein has valves. And since external jugular vein is superficial, atmospheric pressure may compress the external jugular vein, but the internal jugular vein is a bit deep, so that's why we use internal jugular vein for measurement of jugular venous pressure. What is the internal JVP Capper border को कैसे देखते हैं? Those you need two scales. ठीक है, किसके पास हैं scales? ज़रा लेके आ जाएं यहाँ पे. ओके जी, थैंक यू. दानिश आप ज़रा इधर आएं. एक और चीज़ है कि जब आप जेवीपी को देखें तो यू नीड टू आप पुट टेंजेंशियली, आप लाइट टॉर्च के साथ लाइट जब टेंजेंशियली डालते हैं उससे ज़्यादा क्लियर आपको पल्सेशंस नज़र आती हैं, एंड यू कैन ऑल्सो सी द वेव फॉर्म in these cases. तो ये दिखाई ज़रा आप, this is how you through light tangentially look for any pulsations in the neck. So suppose here is the upper border of the venous pulsations. इस point पे तो आप इसको measure करके बताएं.
Ground के साथ इसका level लेंगे basically. One scale should be vertical with the ground.
कहाँ पे?
At the level of sternal notch.
Sternal notch या angle of Lewis?
Angle of Lewis.
So the first step would be to identify the angle of Lewis. ठीक है, angle of Lewis को identify करें.
Sternal notch. First prominence.
नहीं, इससे नीचे, ये तो sternal notch है. ये.
एक रखेंगे scale vertical to the ground. ठीक है. और position 45 angle मुझे नहीं लगता.
ठीक है, okay.
Let's suppose.
You need not to be perfectionist in the exam. Just.
Okay. The other should be horizontal to the ground. And यहाँ पे where the two scales will meet, so we will take the reading of this scale.
Okay, जो vertically आपने रखा है scale, इसके ऊपर आप reading लेंगे, लेकिन जैसे ऐसे रखा तो इसमें क्या problem है? आप okay. So ये भी ज़हन में रखिए कि आपने चूँकि यहाँ पे read करना है तो ये 1 से you start with the 0 1 2 3 4 rather than from the opposite side. So ये आपने यहाँ पे रखा. दूसरा स्केल आपने हॉरिजॉन्टली, अगर आप इफ़ यू कैन होल्ड माइक फॉर मी, आपने जहाँ पे आपको ऊपर बॉर्डर मिला उसके लेवल के ऊपर रखा और फिर यू रीड इट ऑन दिस वर्टिकल स्केल. सो सपोज इन दिस केस इट इज़ 2.5 सेंटीमीटर. नो, हाउ डू यू डिस्क्राइब जेवीपी? द the jugular venous pulsation is, the height of jugular venous pulsation is 2.5 centimeter from the angle of Lewis. When a person is at 45-degree position, वैसे एक्चुअली मेजर कहाँ से करते हैं जुगुलर विनस प्रेशर? फ्रॉम द राइट मिड एट्रियल लेवल, मिड एट्रियम से आप उसको मेजर करते हैं. सो इन व्हेन अ पर्सन इज एट 45 डिग्री पोजीशन, मैं आपकी तरफ से बता देता हूँ कि यहाँ पे सम इन द मिड एक्सिलरी पॉइंट के लेवल के ऊपर समहाउ राइट मिड एट्रियल लेवल होता है. सो व्हेन on an average, when a person is at 45 degree position, the distance of angle of Lewis from the right mid atrium is 5 centimeter. So if you need to tell the absolute value of JVP, you add 5 centimeter to it. So for example, in this case, it was 2.5 centimeter from the angle of Lewis or 7.5 centimeter from right mid atrium. When a person is lying supine, this distance between the right mid atrium and the angle of Lewis is about 3 centimeter. When a person is sitting in the upright position, the distance between the right mid atrium and the sternal notch or angle of Lewis is about 10 centimeter, which means, remember that, कब कहते हैं the JVP is elevated when it's more than 8 centimeter or 3 centimeter from the angle of Lewis. इसकी यूनिट्स क्या होते हैं JVP के?
सेंटीमीटर.
सेंटीमीटर ऑफ वाटर, ठीक है, उसमें आप इसको मेजर करते हैं. ओके, थैंक यू. So when JVP is more than 8 centimeter of water, it's raised JVP. So remember that if venous pulsations are visible in a patient who is sitting in the upright position, it is elevated. Chunki already the distance between the sternal angle and the right mid atrium is 10 centimeter in this individual. So obviously it's about 10 centimeter of water. Then you also need to identify the waveforms. You can actually identify the waveforms with the experience. I am not saying that you would be expected to identify these prominent veins while you are performing the examination at final year level, but you can, and sometimes you can guess. For example, you get these prominent pulsations or waveform in your internal jugular veins, and you also get a pansystolic murmur along the parasternal border, which is more pronounced during inspiration. You know that this murmur is a murmur of tricuspid regurgitation, and with your theoretical knowledge that we will briefly discuss, is you are getting this wave which is prominent V wave. So I mean, you can at least you can guess, okay, it is most likely a prominent V wave. Another component of examination of jugular venous pulsation is hepatojugular reflux. So hepatojugular reflux is measured by applying a gentle pressure over the right upper quadrant of the abdomen. Now this right upper quadrant of the abdomen, the pressure generally applied is 30 to 40 millimeter of mercury. How do you know it's the pressure you're applying is a pressure of 30 to 40 millimeter of mercury? It comes with the idea. I mean, you need not to be precise, but I can tell you it's a gentle pressure you apply to the right upper quadrant. And then you look at the JVP. What is a positive hepatojugular reflux? The JVP rises by a level of more than 3 centimeter, and it remains elevated after 10 to 15 seconds. So if there is a persistent elevation of JVP of 3 centimeter of water, this is called a positive hepatojugular reflux. What does a positive hepatojugular reflux tell you? It tells you that there is extra amount of blood coming to the right side of the heart, and if there is a right heart failure, your right ventricle cannot accommodate this extra amount of blood that results in a raised JVP. So this completes the palpation of the precordium, and then we go to the auscultation of the precordium.